This is Josh's video. You are called to a local elementary school for a child with stomach pain. Upon arrival, you find an 8-year-old boy laying on a bed in the school's nurse's office in the fetal position and crying. School nurse tells you that she is unable to get in contact with the parents.
Okay, so I'm on scene. I got my PPE on. Is the scene safe?
Yes.
Okay, the child's probably sick, so I've got a nature of illness is my mechanism of illness. I have one patient. I would consider ALS. I call for backup, and I would consider C-spine. My primary overview of this patient is a young child sick with stomach pain, probably he's clutching his gut. Is my patient conscious? He's crying.
Yes, responsive and will answer questions.
Okay, is there any life-threatening things that I see right off?
Not at this moment, but severe abdominal pain and vomited twice.
Okay, so the chief complaint is severe abdominal pain. I'm going to assess the airway since he vomited. Is the airway clear?
The airway is open at this time.
Open and patent, so I don't need any suction or anything like that. How's his breathing?
His breathing is rapid, no work of breathing noted, a symmetrical rise and fall of the chest.
Okay, what's his SpO2?
98%.
Okay, so I don't need any oxygen or anything at this time. And I would go ahead and assess the circulation. Does the patient have a pulse, carotid or
yes, he has
radial?
a radial pulse, strong and equal.
Okay. How is the skin?
Pink, very warm and dry.
Pink, very warm and dry. Okay, and there's no major bleeding?
No.
Okay. I would identify the patient as a priority for the stomach pain, and we're going to transport right away. Once we're in the ambulance, I'm going to get a history. So, what was the onset?
Approximately 1 hour prior to arrival.
Okay, does anything make it feel better or worse?
Movement makes the pain worse.
Movement makes the pain worse? Okay. What's the quality of pain?
Feels like he got kicked in the tummy.
Feels like he got kicked. Okay, so I would note that. Is the pain radiating at all?
Pain radiate from the umbilicus to the lower right quadrant.
Okay, so I would find that by palpating the stomach to find that, and then how bad is the pain? What's the severity 1 to 10?
It's the worst pain he has ever had. Child is crying, holding abdomen and grimacing.
Okay, and how long ago did you say it started again?
Approximately 1 hour.
Approximately an hour. Okay, so then I would get my sample. As signs and symptoms is obviously the child's holding his stomach, crying in pain.
Severe abdominal pain near the right side of the umbilicus, nausea and vomiting, temperatures 101.6.
Okay, I would note the temperature. And then does the patient have any allergies?
None.
No allergies? Any past medical history I need to know about?
No.
No? Okay. Any medications that the patient's on?
None.
No medication. What was the last oral intake?
PBJ sandwich.
And when?
For lunch.
After lunch? Okay. And then the events leading up to the pain?
Felt good all day, but pain, fever, and vomiting have manifested in that last hour.
Okay, so then I would do my secondary assessment is probably something gut related, so it's probably intestinal. Maybe. So I need to go ahead and do my vitals real quick. over 80. What is the blood pressure?
112 over 66.
Okay. And then I would do a pulse.
His pulse is 130 beats per minute.
130 beats. Blood pressure, pulse, respirations.
26 breaths per minute.
Okay, and I would listen to the lungs. Take a deep breath for me.
Lung sounds are clear and equally bilaterally.
Lungs, okay. And I would check pupils. What are the pupils?
Pearl.
Pearl, okay. So, I would say that this patient is suffering from some stomach injury. And then I would explain after we got to the hospital that the patient was suffering from a stomach injury, that he vomited, that, that he would be, I would need to reassess every 5 minutes in transport. And then once we got there, I just let the doctors or the supporting help know that the patient suffering from a stomach injury or something going on in the gut, and give them my last vitals and any other information that they needed. Yep.
Do you feel that you have?
Yes.
Okay.